Thanks for coming, everyone. So today we're going to be talking about the rural area veterinary services trips, which are a part of the Humane Society Veterinary Medical Association. So, we'll see what I have to use here. No? Okay. So, kind of intro to both what Humane Society and to what rural area veterinary services is. So the Humane Society Veterinary Medical Association is like an actual national veterinary association that was officially formed in 2008, and they focus on animal health and welfare, and they have 3 divisions. Advocacy, so they have a big department in Washington, D.C. that's active on Capitol Hill. They also do member services, and then their direct care division is rural area veterinary services. And so rural area veterinary services has actually been around since 1995 and just kind of was under a different department, and then once Humane Society Veterinary Medical Association was formed, became part of that. And that department's specific focus is community service and veterinary education. They have 7 staff members. They might have more now, I'm not actually sure. And every year they have over 300 volunteers, which is what you guys can all be. And they provide care to around 8,000 animals every year. So it's a pretty awesome organization. And Dr. Spencer was just pointing out, so the Humane Society Veterinary Medical Association does have student chapters at a lot of schools. Our school doesn't have an actual chapter, but that is something that if a lot of people are interested in this, we could form. And she would be, willing to help with that. And it's something, too, you can just become a student member of the National Association, which is why there was some check boxes on that sign-in sheet if you wanted more information about that. So kind of now more about RAVS. So kind of the mission of RAVS is providing care for animals in need and improving the skills of veterinary professionals. So it's pretty awesome because part of their mission is to help us. And so they want to engage veterinary professionals and inspire their participation in animal protection efforts. So RAVS does field clinics. That's pretty much what they do. But when they say field clinics, they don't want you to think that this is bad medicine. They practice very high quality medical care. And they do it, though, in impoverished rural communities. And then as part of these clinics, they use volunteers, and they do training for their volunteers. So they're also registered to be actual continuing education for veterinarians, and then externships for veterinary students and veterinary technician students. And you learn about field medicine, anesthesia, and surgery. So all the trips within the U.S. are small animal oriented, but there are some large animal international trips. I don't know a ton about those, but at the end we're going to talk to some of the doctors, and if you have more questions about that, you're welcome to ask about that. They also work on community outreach within the communities they work in, and they want to do a lot of recognition and treatment of animal health problems in economically disadvantaged populations. So just because of the populations that we're serving when we go on these trips, you see a lot of diseases you might not see in your typical small animal practice. There's, lots of scabies and different parasites, and there's a lot of parvo and distemper and those types of things that are maybe more commonly vaccinated. So they also are doing some research on that. And one of the doctors that we can talk to, she actually spends like 50% of her time on one of the reservations doing full-time work there and kind of researching some of the issues. So basically these clinics are like the ultimate field clinic. So this is in front of one of our clinics one day. They have this converted horse trailer, and they pull up, and it's all these incredibly organized boxes, and you pile it out. You can set up a clinic in an hour. It's incredibly impressive, with full anesthesia, with gas anesthesia and recovery, and everything can be set up. So it's a pretty well-oiled machine. So where does RAVS go? So where they want to go is where it's geographically remote and economically impoverished, going to communities where other programs do not. So a lot of the communities, like the places I was, there might have been a vet 45 minutes to an hour away. So it would be maybe a little bit difficult to get to the closest vet, but then also they were incredibly impoverished. one of the communities we were in, their unemployment rate was like 95%. So they really didn't have money to care for their animals, but they really wanted to. And I think that's really important to point out. Like the communities that we went to, they actually asked for us to come to them. So it's not like one of those service trips where you're just like going and being like, you need this, we're going to give it to you, whether or not you want it. Like where we were, the tribe had actually decided that this was something they wanted and applied for grants and asked the RAVS program to come to their reservation. So they were incredibly excited and they helped out. They were like very thankful for it. So it's really a fun way to work with the communities. And so at this time, RAVS is going pretty much just to reservations. And they've served over 40 reservations over the last 20 years. And then, like I said, they do some large animal projects and international locations. So Guatemala, Peru, and Nicaragua are the ones that are currently going on. And so these, I think, are the ones that they went to. Last year, I went to Turtle Mountain, North Dakota, and Cheyenne River, South Dakota. So it's really interesting to see the different reservations. Turtle Mountain is a smaller reservation. It's a Jibwa. They were like right up on the Canadian border. Like our cell phones were pinging off the Canadian towers. But they're a lot smaller, so they had a little bit more organization, maybe a little less poverty. And then Cheyenne River is like a humongous Lakota reservation, and that's where one of the counties on that reservation was actually the poorest county in America a couple of years ago on the national survey. So you can kind of go a lot of different places. And then kind of like I was saying, the community is really involved in the trips. So we provide our services at no charge, but they do provide some stuff back. So they give us the facility where we stay, and that really depends then what reservation you're on. Some reservations you end up sleeping in the gym where you're working, so bring an air mattress or like a little camping mattress. Some of them, like mine, we did have dorms, both of them, but like one of the dorms had ice cold showers the whole week, so that was refreshing. And then they also do meals, which are delicious and amazing, like amazing home-cooked meals. One of the places had a casino on the reservation that like catered our meals, which was awesome. So they all get really involved. And then they also provide their own like advertising and support for it. And so then at the clinic, we do preventative health care, so spay and neuter, vaccination, parasite control. Pretty much every animal that comes through gets dewormed, gets vaccines, and if they want, get it spayed and neutered. They also do some sick and injured care and some humane euthanasia as appropriate. So we had like a dog that jumped out the back of a truck and its leg was completely broken, and we did an amputation. There was like a cat with like an infected abscess thing on its arm that had been there for like a while, and we amputated that. They enucleated a couple of dogs. So those aren't things that the students get to do those surgeries, but those do happen, and you can sometimes see that, and so that's pretty cool. And then also they're into doing the community education as well. So at the clinics there's lots of posters and people just talking to the community members who come up, talking about dog bite prevention, about animal care, about disease recognition and prevention. You know, what should you be feeding your dog, like how much and how often, and what are these different diseases. So like scabies is pretty common, and it obviously makes the dogs look pretty bad, but it's really easily treatable. So like that's something we like to teach people. Like you don't need to kick your dog out of the house just because it gets scabies. We can treat it and then still be a happy family. So a lot of education as well. And so every year they treat or they help about 8,000 animals, which is about $1.5 million worth of care that they're doing, which is pretty amazing. And then they're affecting thousands of children and adults and helping educate them about animal care. So it's a pretty cool program. So the clinic. So this was one of the places we set up, and that's the surgery area. So your team is usually 25 to 35 students all around the nation, so from all the different vet schools. So that's really fun. You get to work with people from like every single school. 12 to 15 vets and technicians. Once again, they get their continuing education for this. So really fun. I actually like rode with some of the vets and got to know them and am still in contact with them, and like might go work at their practice for a week with them as like an externship. So it's a pretty cool way to get some connections. And then they also bring along a couple support volunteers to work kind of as like the check-in staff and do kind of the paperwork and things like that. And the clinics are 1 to 2 weeks long. They do usually 30 to 50 surgeries per day and see like 300 to 500 patients a week. So they're really pumping through them. But good medicine the whole time. And clinic days start early and end late, and that is not a joke or an over-exaggeration. I think there was one day we woke up at 4:30 a.m., and we drove like an hour and unpacked the whole clinic and set it up in this like remote outposting, and we're there till like 8 or 9, and then we packed the whole thing up and drove like an hour back. So they're very long days, but they're very rewarding. And each day you'll get your area, so you'll either be kind of receiving, doing anesthesia, or doing surgery. And you work through all the patients that come in. And then they do like evening rounds where they just kind of wrap up. They do suture practice, which is awesome because you get a lot of coaching on really good suture skills. Like these doctors are great at doing spay and neuter. They have a lot of tips to give you. So I definitely improved a lot on that. And depending on the clinic, like one of our weeks we stayed in the same place. Our dorm was right next to the gym that we were set up in. And the other week we moved around a little bit. So you might have to move, like I said, and set up and tear down in a day. So kind of the flow of the clinic. So first you'll do intake. So that will be usually a team of 2 vet students, so like these 2 girls. And so you get to work together with a partner, and you do the whole history and the physical exam. So like physical exam skills, no matter where you are, you'll come out of it much better. You do the number of physical exams you do in 2 weeks is like the number you do in like 6 months when you're on rotations here. So you're just pumping through them, and it's okay if you're like a first year and you have done like 1 physical exam before. Like I think I had done like 1 physical exam before. You just get really good at them really fast. And you also get really good at client communication, which is so important. And it's really interesting to talk to people there, like learning how to take a good history. Like I had a couple puppies where they'd be like, I've had this dog for 2 years. And you'd be like, that is a 9-week-old puppy. So you get really good at being like, did you have this dog at Valentine's Day? And they're like, no. You're like, so you didn't have it for 2 years. So you just get good at your communication and working through things. So it's fun. And then you transfer the patients if they're going to go to surgery to anesthesia. And then there's an anesthesia student that you get to do the catheter, help intubate, help with the medications, and then you do the anesthetic monitoring. So another awesome skill to just practice a bunch. And there's lots of techs and doctors there to help you, but you just get a lot of practice at, they'll walk up and say, how do you think your patient's doing? And you kind of get to learn what you're watching for. And then surgery, and so you will get to, like this is a student here. So you do get to scrub in and learn how to scrub, learn how to gown and glove, and help with the surgeries. It's not a surgery externship at all, but it is an opportunity you will get. And there is a test, which we'll talk about a little bit. So before you get to do surgery, you do have to pass like a skills test with like suturing and knot throwing. There's like lots of videos online. You just practice a lot beforehand. Like there's a lot of people who are in their first year who are able to pass it. And if you don't pass it the first time, you practice at night with the doctors suturing, and they teach you a lot of skills. And then usually the second week you can pass it. You get that second opportunity to get in on it. And that's something too, like if a couple of you are going on these trips and like want me to help you a month or 2 before you go, kind of go over what's going to be on the test, I would definitely be willing to do that. It's definitely passable. You just have to practice and be ready for it. And then recovery, the anesthesia student will recover the patient, and then it'll go back to the intake team for discharge usually. So yet another, good practice. You get to go over what post-surgical discharge usually is. Okay. And so the volunteer experience, like I said, long hours. It's less than ideal work conditions. Like the first week, we were in an unair-conditioned gym, which is okay in North Dakota during the school year, but in July it was really hot, especially when you have autoclaves like releasing puffs of steam every like 45 minutes. But it's still awesome, and it's a lot of fun. It's fast-paced, the accommodations might vary, and it's physically and emotionally taxing. So we just are warning you because it's not like a resort vacation at all, but it's a lot of fun and you learn a lot. And there's no better way to make good friends than all to be suffering at 100 degrees together. So what does a volunteer do? So kind of like I was saying, you may do surgery. It's not like a surgery externship. You have to pass the test first. But once you pass that, and if you're prepared, you probably will. Like I was shaking so bad, and I did not do a great job, and I passed it easily. So once you pass that, you'll get to scrub in and help with surgeries as appropriate, depending on your skill level and what you've done before. And you will definitely get to care for animals, get to talk to clients, definitely gain physical exam skills and learn your anesthesia skills and be exposed to a community you've probably never seen before. And so, yeah, just kind of, again, some things that a successful RAVS volunteer would be. So just definitely flexible and enthusiastic and open to new experiences. And, yeah, so it's pretty fun, though. And then, so if you do want to volunteer, which you all should, like I said, there's some preparation and training before, which is important. So practicing those suture skills, there's a bunch of things online that you just read through about all the way their clinic works, their anesthesia protocols and surgery protocols. And there's like a little test online. It's not hard to pass, but it's just to make sure you read the things. So you'll do some preparation and training beforehand so that you'll be ready right when you get there. You are responsible for your travel to and from the meeting site and your lodging. If you fly in the night before, you have to pay for hotel. And then like bringing a couple things like your stethoscope and your thermometer and some surgical gloves. And then for students, there is also a CrowdRise commitment. So I think for my trip, it was like $400. But they give you plenty of time. I sent out emails to like all my family and friends, and I was able to raise all that money. And if you go to one of the ones in North Dakota, South Dakota, they go out of Bismarck. And there is flights like direct from Orlando Sanford to Bismarck for like $200 on one of the budget airlines. So that was pretty awesome. And so if you're interested to apply, there's the website. So there's this one, hsvma.org/RAVS, and there's also ruralareavet.org. It's on a couple slides coming up, and it'll be on my last slide too. So if you don't catch it right now, it'll be okay. So you'll submit an online application. It's got like some little short blurbs, like what is a good RAVS volunteer and why do you want to do this kind of things. And it's not a first come, first serve basis. They do, look through all the applications. There's some schools that they get 100 applications. Like it's a really big thing at some of the schools. So some of the schools are really into it and it's really competitive. But not many people usually apply from Florida, which is good for us because that means you're more likely to get in. And then they give you a list of deadlines on when you need to get your fundraising done and your training done and all of that. So then you'll have to meet those and then you can go on the trip. And so next summer there's probably going to be about 12 field clinics. The schedule will be posted on November 25th, and then applications will be accepted from December 3rd to December 15th. And those are those two websites. If anybody wants to write those down, that's kind of the deal. There's a few people taking pictures, so I'm just going to wait a second. Yeah. And then we can go back to that too if you want at the end. Okay. So then my last little bit are my top 6 reasons you should all go on a RAVS trip. So number 6, basically every photo I took on the trip looks like this. There are so many puppies and kittens, and they are so freaking cute. Look at that, it's 2 weeks old. And if you really fall in love with one, notice that we are in a car. This is someone going home with one. Not me, but one of the people in my car. I really wanted this puppy. He was also up for adoption. Number 5, you get to go someplace you might not otherwise go. So, it was incredibly beautiful. You go, hours without seeing a billboard or any junky, stuff that usually is all over our highways. And so it's just incredibly beautiful. And you get to learn about interesting cultures. So these are just different artwork that were on, the buildings that we were at. So this one was really cool. This was a center we were set up. This is our clinic happening down here. And they just had these beautiful paintings of different important things to their culture, and they came through and told us all about them. You know, like this is the Sundance, and I think like over here, this one's like the massacre at Wounded Knee. So they told us all about those and why those are important to them. On one of the other reservations, they got a school bus and piled us all in a school bus and drove us around for a tour of the reservation. So they really want to share their culture too, and it's really cool to learn about. Number 3, you meet awesome people, students from all the other vet schools, the veterinarians like I was talking about, the vet techs, the staff that actually works on the trip, the community members that are helping you out. Like everybody is so amazing. This was our team, and it was just a great group. It was really fun to work with all of them. And now I get to like know vets from all over the U.S. We all also bought matching cat tank tops, so you can do that too. It's pretty cool. And number 2, you improve your skills and learn new techniques. So like, you know, here we're examining these 2-week-old kittens, and we had to learn how to like age kittens and how to tell their gender, which being from a practice in a big city where like animals don't have babies, I just never saw animals that young before for like an exam. So like that was fun, and lots of placing catheters and getting good at that, and monitoring anesthesia. So lots of learning. And then my number 1 reason you should go is the communities. They are so incredible. They're so thankful. So like they made us a cake at one of them, and it was really cute. And this is Indian tacos, which are amazing, and they're on this like big puffy flatbread, and they make those for you all the time, and they're really good. And I couldn't find a picture of it because I think we were all too tired in the morning. But like at one of the reservations, every single morning there was people there at 3:30 a.m. lining up for our clinic, like hundreds of people. It was insane. Like they really, really appreciate what you do, and like they will then sit there for 8 hours before you examine their puppy, and you like vaccinate it and send them on their way, and they're like so thankful for what you do, which is incredible because, you know, you come here and somebody sometimes waits for 8 minutes and is upset, but they're just really, really excited about everything. So that's definitely my number 1 reason everybody should go do these trips. So now we're going to do questions, but first we're going to take a little break. We're going to get Dr. Anna and Dr. Lisa, who are 2 of the staff members, are going to join us and help answer questions. So those are also the websites again, so that you can get those if you didn't earlier.
So anyways, yeah, my name is Lisa. I am a 2009 Ohio State grad. And started volunteering with RAVS as a student right after my first year, and just absolutely fell in love with it, and kind of became like a RAVS student stalker. You know, went on as many trips as I could the first few years of school, and then took a few years off I did a small animal internship, and then came back as a volunteer vet. And then they were kind enough to hire me as a consultant, and now finally, as of earlier this year, I am a full-time staff member working on the regular field clinics that Sarah was talking to you all about, but also a special project here in on the San Carlos Apache Reservation in Arizona. And I, in general, on the clinics, I am involved on the receiving side of things. So I loved, again, Sarah did a really great job with her description of what you do on receiving. I really love it. I think, again, I learned just so much as a student, how to communicate with clients, and I still learn. You know, every trip I learn something different from the students and from our other volunteer professionals, so it's really great. But especially up front, it's really rewarding to get to interact with the clients and again, learn how to get through those stumbling blocks of, you know, two-year-old dogs with baby teeth. And how to communicate different things, and lots of practice. You know, you'll be, depending on where you come, to infectious diseases and other things that you may or may not see back home in Florida. So that's a little bit about me.
Awesome. Anna? Oh yeah, Dr. Anna, we see you, so you can go ahead.
Sarah, that was awesome. Thank you. We're going to take you to other schools with us. Dr. Lisa and I were just at LSU, but we should have just sent you down there to promote it for us.
Yeah. Gladly.
Yeah, I didn't realize we were going to have webcam, and I was thinking I would have dressed up for you, but then you wouldn't have recognized me. So, I I'm Anna Simonson. I'm a staff veterinarian for the RAVS program. This upcoming 2016 season will be my 5th season as a full-time staff member. So during the season, I'm on clinics as a trip leader. I'm often the surgery lead, as well as in surgery doing some of those big, oozy spays that other people want to cry about. And then making those people that want to cry come do them with me, because it's always more fun to have more hands. I went to the Atlantic Veterinary College in Prince Edward Island. I went back to vet school later on in life. I did equine work initially in vet school, but was pulled in the direction of shelter stuff. And field work has been an amazing path to follow. Similar to Dr. Lisa, I was introduced to volunteering as a vet student on RAVS in my first year of vet school, and then continued to go on trips, as many as I could each year, until I graduated. And then as a baby vet, I went on RAVS trips and was just sucking up all the mentorship, and also still continuing to learn from the students that I worked with. And that's actually where Dr. Lisa and I met, in Coffee County, Georgia. And then I continued to volunteer and became a full-time vet with them. In the off-season, I work on building the program and updating our protocols and supplies. I work with our volunteer veterinarians and a whole bunch of other things. So if you have questions on the small animal program, from the viewpoint of a student as well as a volunteer vet or a staff vet, I've done that. And then I also spent a bit of time in Nicaragua on the equine international trips. So I can speak to those if people have questions.
Okay, great. So if you ask questions, I'm going to repeat them so that they can hear it, but does anyone have a question? Okay, so the question was about, are all the trips, are they 1 week, are they 2 week, are they in between, and are they all at one place, or do you kind of move around, and how do you get assigned to a certain trip?
Sure. You want me to take this one, Lise?
That sounds good.
Okay. So in general, we try to spend at least 1 week on a reservation. And as Sarah mentioned, that might mean the same location on that reservation or multiple locations on the same reservation. Many of our clients struggle to find transport, or if they have a car, struggle to have gas money. So we try to do clinics, bring the clinics to them, or help them coordinate rides through our community contacts. We try to pair up for students 2 weeks of back-to-back clinics. So you're on one reservation for 1 week and another reservation somewhat nearby for the second week. And we do that because not only do you get exposed to more vet and vet tech volunteers, because your team of leaders, staff, and volunteer professionals might change out during that period of time, but you also get to gel more as a team, and the things that you're working on the first week of the clinic, when you've maybe never done a physical exam before, and it's really overwhelming to be working with a brand new team of 49 other people, and you're getting used to the living conditions and the flow of the clinic. The questions that you're asking then and the learning points that you have on that beginning of the first week are so different from where you guys are at the end of the second week. And so we try to pair up one reservation where maybe we don't move as much, or where our animals are a little bit healthier, with a second reservation where the animals are a little more compromised and we have more challenges in terms of moving. And that way our reservations get the benefit of the student teams, and the student teams get the benefit of a variety of communities and a longer learning period. We do have a few clinics where we have such need and the numbers within the communities are so big that it's, say, a 10-day trip. So we tend to go to Standing Rock for a longer period of time, and we don't match that trip up with another trip because the need involves more days. Does that make sense?
Yeah, I think that was perfect. And then as far as for applying, you can apply for specific trips. So.
Yes. Yep. Oh, and how the teams are made up. So our director, Wendy Wojtak, does an amazing job of trying to create a multifaceted team. So her goal is to have people, professionals and volunteers with really varied experiences in terms of novice and advanced in the same field, but also in different fields. She likes to bring back returning students, but also have new students. In terms of professionals, we like to bring an emergency vet and a shelter med or high-volume surgeon and a general practitioner, and say a technician that works at a shelter and a technician that works at a university and a technician that's at a specialty clinic. Because we figure that we all have things that we're naturally good at and that we have more experiences in, and if we all bring those to the team, wow, those animals they get the best of everything. And then at the same time, we can all share with each other our specialties and our experiences and take away things to help animals in our own communities.
Cool. Yeah. So does that answer all your questions? Did you have a question over here? Sure. So we had a question about the equine international programs. You know, what is kind of the basic setup of those, and how are those run?
Yeah. So those are a bit different. They're smaller teams to start, and they are focused on sustainability within the country, and as a result, they're very inclusive of local veterinarians and technicians, as well as animal care workers and local vet and tech students. And then they bring a small team of vet professionals and vet students from the States to sort of enhance the teamwork and the knowledge sharing. The team, I'm trying to think, I haven't been on a trip in a while, but the team would be more like 15 people, say, rather than 50. You work in very rural areas. In Nicaragua, we were there for about a 2-week period of time, and we traveled extensively to different communities. The conditions were even more rural. On a RAVS trip, a lot of times we may be 50 of us sharing one toilet that isn't working very well in one community building for that particular day. More likely a few more toilets, but you never know. There it was, latrines or use of the jungle. The work is focused on working equids, so you're doing medical care for working horses, donkeys, and mules. The majority of the treatments are similar to what we provide for the small animals, so doing physical exam, vaccination, deworming, addressing any questions that the clients have, and then castration, if that's something that the client is interested in. There's also, we see a lot of saddle sores, so doing education on proper fitting of tack and ways to keep the animals healthy when they really are they're essential to life there. They're not only the way that you get to work and your work partner, but they're the way to go get water and bring it back to the house. It's how your children go get food. It's how you get to the market. It's how you socialize. And so trying to teach preventative care as well as handling.
Okay. And is the application the same for that, and is it at the same time?
I will, if someone has a specific question, you have my email, but you can
Yes.
pass out my email and just contact me, and I can get more specifics.
Okay.
Because I believe that the application might be more of a rolling process.
Okay. Okay. Any other questions for our doctors? Yes.
So like I'm a first year, so if I went, like what's my whole 2 weeks like? Is it just depend on what I'm comfortable with, or like?
You'll do everything, but I'll let them answer that. So for a first year, what does their 2 weeks look like coming out of first year? How much will they really get to do?
Lise, you want to take this one? I'm tired of hearing my own voice.
Sure, I can try, and you can chime in. So again, the really fun thing I think we've kind of touched on a few times is that we get a wide variety of students, and again, we have some first years who have been working in the field for a very long time, and some who, like for example, we had a student this past summer who was a large animal first year student and had never even taken a temperature on a dog, and so her very first day on receiving, that's what she wanted to do, and she got to do it, and it was great. So it really depends, and the other fun thing I think about RAVS is that we, you have a lot of responsibility, and so that can be a little bit intimidating at first, but we try to always have a lot of support and mentorship available to you. So again, depending on your skill level and in what area of the clinic you're working on, you'll be involved with various things. So if you were on receiving the first day and had never, weren't very comfortable with small animals or hadn't done physical exams or treatments or any of those things before, we would have the goal of pairing you up. We do have orientations each morning, so I don't know that that was mentioned, or maybe I didn't hear that in the presentation, but we will have a big orientation for each section of the clinic. And then after that, we would pair you up with a student who maybe was a fourth year or had felt more comfortable with handling and exams and those sorts of things, or a student had been on RAVS before. If we have the staffing, we also would potentially be able to have one of our volunteer vets work with you on your first case or first couple of cases, just so you can kind of feel more comfortable. But there's always several vets, again, kind of floating around, checking in with you and assisting you. In anesthesia as well, for your very first case after your orientation, they try to pair you up in teams of two, again, attempting to have more experience with less experienced students to run through your first case or two, and then you're running anesthesia cases on your own. However, through induction, you're working with a one-on-one with an induction technician, and when you're actually monitoring your patient under anesthesia, we have one technician walking back and forth amongst the 5 students, monitoring the 5 patients on the 5 surgery tables, and that technician's sole job is to just walk back and forth and check in with the 5 of you constantly and assist you with whatever you may need. And in surgery, you would be, if you're able to pass the surgery tests, you are virtually guaranteed a surgery spot. I can't think, and Anna, you can chime in, I can't think of a time where we had students passing the surgery test who were not assigned at least a day of surgery. And you will be working one-on-one with a veterinarian for your surgeries. So if you had never done a surgery before, what Dr. Anna and the other surgery leads ask you to do, and I love their approach, is to identify certain goals. So your goal might be to touch everything, to learn what the uterus feels like, or, identify both of the ovaries before you start ligating things. Or maybe your goal is to learn how to place ligatures, and so you would place one and your vet would place one on each, part of the anatomy that you would want to do the ligature. And so we really try to work hard, pushing you maybe within and maybe a little bit outside of your comfort level, giving you a lot of responsibility, but also being right there to, give assistance and advice and mentorship, and allowing your other team members, our volunteer vets and technicians and other students, to play that role as well, and giving advice and offering some leadership within the clinic if they've been on a trip before. I don't know if that answers the question or if Anna has anything to add.
I was just gonna. I think that's a great explanation, and I was just gonna add that we realize that the beginning of a clinic, if you've never been on one before, is big and overwhelming, and that we give you a lot of responsibility. But rest assured that we're looking to keep you within your comfort level, but push you so that you realize that you're capable of more than you even know. And help you to safely take on new challenges all week or 2 weeks long. There's also, as Dr. Lisa said, other students that have been on trips before, and that's one of their roles, to be supportive of the new students and help them sort of figure their way through those first few days. And then we always have staff in each of the areas, so there's a trip leader who is ultimately responsible for every single animal that comes through the clinic, as well as every student, every volunteer, and all the community needs. And so we built a lot of checks and balances into the clinic, so that we can give the students a lot of freedom to obtain new clinical skills, as well as keep the animals as safe as possible. There's a lot of communication between staff members, and we really want it to be a positive and open learning experience. So, there are no stupid questions. We're all working long hours, so you might need to ask the same question more than once, and that's totally understandable. And also, a different person might be able to give you a different answer that kind of satisfies your question in a different way. And ultimately, we have somebody in every position watching out for all the animals as they come through the clinic. So you should feel good about that, and feel good about how much responsibility you get to have.
Yeah, for sure. And especially by the end of the 2 weeks, every student at every level is doing their own exams, their own histories, placing catheters, really doing every step, but you just build up to it with your comfort level. But definitely everyone was involved throughout the way. And the first day, there was definitely a lot of people who were like, oh my gosh, I've never had to monitor anesthesia by myself and make decisions, and they'd be nervous. But you do one or two, and then you're like, oh, I got this, I can do it. And then you rock it, and there's always someone there to help when you're feeling a little unsure. And they're really great too. It's like clinics where they'll be like, well, what do you want to do? Your patient's blood pressure's low. And you're like, oh, I think I want to do a fluid bolus. And they're like, great idea. And they tell you how to do it. So it's good. Any other questions? Yes.
Sorry, I missed making you talk there.
That's okay.
You might have missed it. But is there an average number of surgeries that a third year would be doing?
Yeah.
And what type of surgeries besides sterilization that you experience with?
Okay, so kind of question was, how many surgeries would you do if you passed the test? And so this student that's asking would be coming out of third year going into fourth, so already have gone through some clinics and stuff, so what would they get to do?
Yeah, so it totally depends on what your experience level is, and also the veterinarians that you're paired with, what their experiences are, as well as how compromised your animal is. So on the reservation that Lisa works on a regular basis in San Carlos, our animals have tons of tick disease, and so there's a lot of clotting issues, and there's a lot of postpartum animals, and so the surgeries are very challenging even for our high-volume veterinarians. And they're not the typical animals that our general practitioners see. And so we try to find a balance of keeping everybody within their comfort level, but getting the students as much experience as possible. For sure, our students that come on multiple trips, we know where you're at, and we are able to help build your skill set over time. Because we've seen you work and we've been there, you're growing. But we still try with our students who have had a focus in, say, shelter MAD and have done a lot of surgeries already, to let you, if you're at the point where you can spay a cat and you can, you're working on getting it done within our surgical time limit, we will pair you with a vet, and that vet will be your assistant, and their job is to, keep an eye on how things are going, give you pointers, and you're working from the beginning of that cat spay to the end of that cat spay, as long as the cat is doing fine under anesthesia and you're within the 45-minute time limit. And they might just be there to push you along a little bit at some point. In a big, ginormous, bloody dog spay, we may ask that you're an extra set of hands and I'm ligating something and then you're ligating something, and we're just working through it together, and it's going to take us the whole 45 minutes just to get through it. If you're at the point of doing a young adult dog spay and you could get through half of it, we'll have you do that. It really depends on each individual student, but also, as I said, where the animal is at and where our volunteers are at in their comfort level with those compromised animals. In terms of numbers, we try to do 30 to 60 surgeries a day, and that is dependent on what our team looks like, if we're moving that next day, and how compromised our patients are. And then the number of surgeries each student gets to do depends on how many pass the surgical skills assessment. So we generally have 4 days of surgery in a week and 1 wellness day. And that wellness day is there as a day to help the population of animals in terms of their medical health, but also to see any complications or rechecks that we might need to see, and to follow up on any emergency care that we're doing. So 4 days of surgery, anywhere from 25 to 35 students. And if everybody were to pass the test, we have had days where there are 8 students on surgery, and we're doing 50 surgeries that day, say. We have had days where there's 5 students, 4 students on surgery, and we're doing 60 surgeries, or we're doing 30 surgeries.
Yeah, I know.
I don't have the exact number. It's really hard. We always want you guys to do more, and we want to do more for the community, but we also, everything takes a little bit longer because a lot of people are doing things for the first time, and so finding that balance can be challenging sometimes.
Yeah, I know from my particular trip that I think it was probably everybody, if you passed the surgery test the first week, so you were on both weeks, you probably got 2, or a couple people got 3 surgery days. And if you passed the second week, everybody did get at least 1 surgery day. And then I would say from my own experience that you probably got 3 to 5 surgeries a day, kind of depending on how many there were, like she said, and how many students there were. Like the second week, since we had more students, there was a little fewer surgeries to go around than the first week when a fewer people had passed. And then kind of based on experience level, like I had done a couple neuters by myself, so I was able to do kind of like what she said, a neuter with the doctor just assisting me. And then when I did a spay, we kind of did it more where it was like I did some of the ligation and I did like a bit, like 2 of the layers of the closure. So I did part of it. But for the healthy animal, there is like a time limit, so you want to make sure you're working within that too.
Yeah, and we do have, some surgeries that are expedited, and so there aren't any students involved in those, like pediatric surgeries. We try to factor that into our timing in our day and still, add on some more student-involved surgeries, but we just never know what the animals are going to be like once they get through receiving an anesthesia. In terms of other surgeries, we see a lot of the surgeries that I think of in terms of shelters where we're doing wound repairs, mass removals, enucleations, amputations, mostly pretty much soft tissue things. We have done some abdominal explores. We see a lot of big dog, little dog bite cases. So we might do an abdominal explore on that animal and find hernias and fix those. here and there, we've done a resection and anastomosis, but we have to keep in mind that we're doing field medicine, anesthesia, and surgery, and so when we're thinking about the outcome for the animal, we have to keep in mind how much longer they have access to us for medical care, excuse me, and what the family members are capable of, because we want the animal to be better off for having met us. And so sometimes that one animal might be appropriate for an amputation, say it comes in midweek, versus an animal that comes in on the last day of the clinic and is a free-roaming dog that a couple of neighborhood people take care of together, and we can't find anybody to say that they can keep that dog indoors and care for it. And we do a lot of communication via text and photos and follow up on the phone with people. And we'll go to great lengths to try to find a solution for an animal. But I will say that sometimes the kind of solution is humane euthanasia. And then there's those other times where it's adoption. You know, we're not an adoption group, but we've got a lot of good suckers sitting in the room when we're there, and sometimes the animal needs to go, and it just works out.
Yeah, I think we did a couple amputations and enucleation, and I think we had a couple big dog, little dogs as well that they worked on.
Cheyenne River was crazy this year. You were on crazy trips.
It was crazy. Okay, any other questions? All right. I know that everybody has exams this week, so thank you so much for coming out, and thank you to Dr. Anna and Dr. Lisa for joining in with us and answering questions way better than I could. Oh yeah, okay, so I'll post, I have Dr. Anna and Dr. Lisa's emails, so I'll write those up. You're welcome to ask them questions, like if you have questions about the international trip, they're pretty great, and they'll answer your questions and not be annoyed by your pestering them. All right, any last minute questions? All good? Thanks everybody, thanks Dr. Anna, Dr. Lisa.